My first day at Duke University, that first week, I said there's absolutely no way. I will never go to med school. It's never gonna happen. And they tell you, never say never, and look where I am now. Senior year, actually, after volunteering in a study, which was a nerve block study where an anesthesiologist gave me a nerve block, knocked out my right arm. I spent 4 hours with him waiting for it to wear off, and he convinced me to go into medicine. And so health has been kind of a central focus of my family for a while, and I didn't really know how I was gonna approach it. And that senior year and then my time at the NIH kind of pushed me in this direction. I don't know if you notice the things that I've gotten into, a lot of it actually is with children, and I really enjoy hanging out with kids, playing with them, like getting them motivated, like trying to help them in any kind of mentoring way that I can. At Duke, I did this Rainbow Volunteer Program in the Pediatric Bone Marrow Transplant Unit. That was kind of the first time I had really worked with, I would say, children in a patient setting, in a hospital setting. So that kind of started it. And then also in Nicaragua, I was working with kids, getting them involved in, as I said, like nutrition and exercise, health, and hygiene. And then from there, Boys and Girls Club was this project that the American Medical Association actually was pushing for, and it was a walk around the world, and it was a fight against obesity. And I think that this is a hugely necessary project. There was an individual I'll name him Joe, and then he was set, he had what we'd call a hairy cell leukemia, and he needed a bone marrow transplant, and as many of these pediatric patients do. And it was a 15-year-old that I would hang out with every week. We would do anything from drawings, kind of arts and crafts, to playing video games. And one Tuesday I showed up and Joe wasn't there anymore. And I got an email later to talk to the director, and they mentioned, you spent a lot of time with Joe, and the family really appreciated it. We are sorry to say that he didn't actually make it through the bone marrow transplant and passed away. And it's something that struck me really deeply and really hard, because that was my first patient, I would say, first patient that passed away that I ever had. And he was so young, he was 15 years old. And that kind of idea that maybe as a physician in the future could be preventing such early deaths, such horribly early deaths, that it would be worth it if I could just change maybe one of those, prevent one of those in my life. I have a dream in the future that I would actually not only go from pain management, having a clinic in pain management, to having actually like a lifestyle clinic, in terms of taking in individuals, looking at their prescription medications, looking at their lifestyle, their diet, their exercise, their mental well-being, and being able to reduce the amount of medications they're on, change their lifestyle for the better so that they are helping themselves. We're told so many times that a physician should be a community leader, and I think that there's really no better way to be a community leader than to actually be volunteering in the community, helping people out and trying to build up whatever community you're in. A physician, they want to change the world, they want to make a huge difference, but one person cannot always change the world, but you can change the world for one person, and through that, you might actually end up affecting a really large amount of people.